Shoulder arthritis can cause some serious pain and disability, and if it keeps getting worse, it might eventually set you up to need a joint replacement. It can keep you from lying on your side and keep you from raising up all the way, as well as from picking up anything heavy. So in this video, I'm going to explain to you everything you need to know about shoulder arthritis, the symptoms, the treatment, the root problem, so that you might understand it and know how to fix it. So let's first define what is shoulder osteoarthritis. There's different kinds of arthritis. I'm talking about osteoarthritis today, which is the wear and tear, age-related arthritis, which I disagree that it's an age-related thing, but let me tell you some more about it. I'm gonna bring my skeleton in here. So here's the shoulder joint, just to give you a quick anatomy lesson. There's the ball, there's the socket. The socket is part of the shoulder blade right here. And the way the joint works is you can reach up overhead and there's movement in there. There's rotation involved. And there are many muscles involved in the motion at the ball and socket joint, as well as the motion of the shoulder blade itself. Another way to think of it is if we put this on this side, when you reach up overhead, the shoulder blade should come up overhead too. When you reach forward, the shoulder blade can move forward and backwards. This is important. I'll tell you why by the end of this video. But in shoulder osteoarthritis, what ends up happening is there's bad forces going through the ball and socket joint for a long time, usually months and years. And when those bad forces are there for a long time, it causes the joint to change. It causes it to adapt. So over time, you get a loss of cartilage there because it gets smashed and worn down, and then the bones change as well. That you get bone spurs, or what's called osteophytes. That's what you'll hear in the medical community. And that's what blocks proper motion inside the shoulder joint. And usually leading up to shoulder arthritis, people have rotator cuff tears, and even before that, they might have shoulder impingement problems, tendinitis, bursitis issues. Those are all related problems that end up with the development of shoulder arthritis. And the reason for that, I'll tell you more about this at the end too, is because of a muscle imbalance. Understanding the muscle imbalance will be critical in fixing this problem. Stay tuned throughout the rest of the video so you can catch that part. Now let me tell you the symptoms of shoulder arthritis. It's gonna be pain directly in the shoulder, usually in the front, and especially with reaching up overhead. But the shoulder will also be painful just at rest. It tends to be more painful if you lie on it or if you support your elbow too much. Sometimes this will cause a relief of the symptoms. Sometimes it can cause worsening of the symptoms. You can also get pain that radiates down into this part of the shoulder. People think that this is the shoulder joint right here sometimes, but what I'm really pointing to is this part of the arm. That's not the joint, that's the arm bone. But there's nerves that come off the neck that pass under the collarbone and around the shoulder joint, the shoulder blade, and around the joint too. And one of those nerves in particular, called the radial nerve, passes right here. It goes right behind the ball and socket joint back here, and it can cause pain to be sent to this area out here. So a lot of people mistaken this as being like a rotator cuff pain or a shoulder arthritis pain, but really it's a nerve pain. In severe cases of shoulder arthritis, you might get grinding, excessive popping in the shoulder joint, or loss of motion, like you can't rotate out this way, or you can't reach up behind your back as far on this side as you might with your good shoulder, and limitations in being able to reach up overhead as well. You might be stuck. Usually, as shoulder arthritis advances, it hurts a lot at the beginning, and then you adapt. And if it's there for a while and it hasn't been operated on, there's a period of time where it kind of stops hurting. You kind of get used to it, but you have limited motion that just is always there. And it's questionable as to if it's because you don't have a rotator cuff muscle that's connected anymore, a tendon that got torn, and so you just can't pick it up because the muscle can't function anymore, or if the osteophytes, the bone spurs, the changes in the shape of the ball are so bad that you don't have good mechanics in the joint, and so you can't reach up anymore. So it's questionable with that. Now, as far as the diagnosis of this problem, when you go to the doctor for shoulder arthritis, they're going to take an x-ray. The x-ray clearly shows the space within the joint. There should be some normal spacing. In arthritis, though, the spacing starts to disappear. You start to get the bone going up into the socket, and that's when they would tell you that you're bone on bone in your shoulder joint. In some cases, you might get an MRI as well, which will show the soft tissues like your biceps tendon That's this thing right here. That tendon, believe it or not, comes from this muscle, the bicep muscle on the front, the flexi muscle, and it attaches on the inside of the shoulder joints, right outside the inside of the shoulder joint, really close to the surfaces of the joint. It'll also tell you on the MRI what the state of the rotator cuff tendons are, and you just get more information off the MRI, but very often your doctor will be able to just take an x-ray and tell you from that if you have arthritis. After that, the doctor is going to discuss treatment options with you, and the first line of treatment is always going to be medications. They're going to tell you to take over-the-counter medications. You might have already been taking them leading up to that appointment because you were dealing with shoulder pain. The doctor might then say, try these prescription strength pain medications, which will be a little bit stronger. If that doesn't work and you go back for a follow-up with a doctor, then they're going to recommend injections. An injection could be a steroid injection very often. That'll help reduce inflammation and pain in the area. However, there's research showing that too many injections can break down connective tissue, which is heavily in your ligaments, your tendons, your cartilage, and your bone. And so you're only limited to having 3 injections per year. And actually there's research that just came out that shows that even 1 injection in knees can start to accelerate arthritis. So there's no research like that for the shoulders just yet, but I wouldn't be surprised if it's the same case for injections done in the shoulders. So just be careful when getting a shoulder injection. Make sure you address the root problem so that it doesn't have to come to that. Along the way of getting injections, you might be recommended physical therapy. And at physical therapy, you'll do a variety of exercises, which I'll talk more about in just a moment. If physical therapy doesn't work for you, then you'll get recommended surgery. And the most common surgery done for shoulder arthritis is a joint replacement, a total shoulder arthroplasty, which is fancy words for a shoulder replacement of the joint. There's 2 different kinds of shoulder replacements done. One is your normal total shoulder arthroplasty, and then the other one is a reverse arthroplasty. And just to show you what I mean, a regular shoulder replacement means that they're cutting off the end of the ball here and replacing it with an artificial ball, and then they're putting an artificial socket on the other side of it, and then you have a brand new shoulder at that point. That is reserved for when you have good rotator cuff muscles and tendons still. But if you don't have a good rotator cuff tendon or muscles, then what might be done is a reverse total shoulder arthroplasty, which is where they cut off the same parts of the ball and socket, but they'll put the new artificial ball on the scapula, on the shoulder blade, and then they'll put the socket on the end of the arm bone right here. So the ball and socket are reversed. And this is done because it's a little more stable that way, which is what you need if you don't have good rotator cuff tendons and muscles. Now, there's disadvantages to both and advantages to both, but ideally you don't want to end up in that situation where you need to have a shoulder replacement. Now let's talk through exercises that are typically done for a shoulder arthritis situation. If you end up going to physical therapy or if you look up videos online, most will tell you to do very simple kind of movement, low movement based exercises. Like a common one is pendulums, for instance. This is where you would put a hand on the table and you kind of lean over and then you just move your body around and you let your arm just swing around like that and use the weight of your arm. And that might be okay to do if you're in a high pain situation, but it's not doing a whole lot to improve the muscle imbalance, the root problem of shoulder arthritis. But I commonly run into patients that have shoulder arthritis that are indefinitely doing pendulum swings because they saw that on the internet, a doctor told them to do that, or a physical therapist told them to do that, and they're following instructions and still doing pendulum swings when they should be moving on to much harder exercises. Sometimes you'll do harder exercises in physical therapy that involve bands or cables where you're rotating this way. You might be pulling out your arm from your body this way with the cable or resistance band going this way, or you might be going the other direction with the cable or resistance band on the outside of your hand and you're pulling against resistance this way. You could do a variation of this where your arm is in a 90-degree position and you're pulling this way. The tension point would be pulling from here, or it's behind you and you're pulling forward this way. These exercises, the intent behind them is to strengthen the rotator cuff muscles, but in some situations, people with shoulder arthritis don't have good rotator cuff muscles, and then what isn't considered is the root problem that led to getting shoulder arthritis, because if you understood that, then it would make sense that you don't need to strengthen the rotator cuff muscles. We need to focus on scapular muscles instead, the shoulder blade muscles. So let's talk about the root problem, because If you can understand that, then you can give yourself the chance to heal your shoulder and possibly avoid a shoulder replacement and avoid having to deal with more shoulder pain as time goes on, and perhaps even get back to doing the things you love without your shoulder bothering you so much, or maybe you can get rid of the pain altogether. The root muscle imbalance of shoulder arthritis is that the rotator cuff muscles are overworked and they're pulling the ball into the socket excessively, and that pressure is causing the ball to get smashed into the socket, and that's what's shrinking the space there, injuring the cartilage. Over years, it's causing osteophytes, the bone spurs, to develop because the joint's just being smashed in. Eventually, you get rotator cuff tears, which happen because they're overworked. That's why they tear. And then the rest of the rotator cuff muscles have to work. And you have other compensations that happen too, like the deltoid muscles, the muscles that kind of form the shape of your shoulder out here, the ones that look good on guys, the ones that come out this way. Those muscles pull upwards like this, and they can add a lot of compression to the shoulder joint as well. That muscle directly influences the ball and socket joint, and that muscle is the one that you work out whenever you're holding a weight and you're lifting up right here from your legs, and you're coming up this way, you're coming up to the side right here. That one will tire out this muscle, but it's feeding the imbalance. It's causing there to be increased pressure in the ball and socket joint. And if we're trying to preserve your rotator cuff tendons and make sure you don't develop arthritis or worse arthritis if you already have it, we have to decompress the joint. And the way we do that is by strengthening other muscles that don't force those two muscle groups, the rotator cuff muscles and the deltoids, to overwork, to compensate. So what we have to do is consider the upper trap muscles that run here, the shrugging muscles. They start at the base of your skull and they attach to all these points in the neck here, and then that muscle comes outwards and attaches to the corner of the shoulder. And its job, whenever let's do this side, it comes from here to here. Whenever you reach up overhead, like I said earlier in the video, if you're reaching up this way, that upper trap muscle should be rotating your shoulder blade upwards and pulling it up so that the socket on the shoulder blade goes from this position to this position. Because when you do that, now you don't have to work your deltoids so much because you're making your upper traps work, and you don't have to work your rotator cuff muscles so much. All you have to do is make sure that you shrug properly. And there's more to it than this. I call it the rule of the hand. I've talked about it in other videos, but the root problem, just to be super clear, is there's poor shoulder blade motion. It's not taught well in the fitness world, in the healthcare world, but if we can begin to fix that in your shoulder, then you can take pressure off the ball and socket joint here and stop arthritis from progressing and hopefully prevent a shoulder replacement surgery. If you're looking for more exercises to help a shoulder arthritis problem, well, something to take into consideration is that you probably have a rotator cuff tear too. And so these exercises right here, the top 5 exercises for rotator cuff tear, will help you out if you also have shoulder arthritis. Go check them out.